Hello, my name is Robert Zeiser. I'm the director of the Division of Stem Cell Transplantation and Tumor Immunology here at Freiburg University Medical Center in Freiburg, Germany. Today I will talk about the topic, how might emerging therapies and combination approaches reshape future sequencing strategies in chronic graft-versus-host disease. Chronic graft-versus-host disease can affect 40 to 70% of the patients that undergo allogeneic hematopoietic stem cell transplantation. This disease, chronic GvHD, is characterized by a complex immune dysregulation that leads to persistent inflammation and fibrosis. And severe chronic GvHD leads clinically to a long-term reduced quality of life after allogeneic stem cell transplantation. Currently, corticosteroids are the first line of therapy. They are partially effective, but they have significant toxicities. Recently, FDA-approved approaches include ibrutinib, belumosudil, ruxolitinib, and axatilimab. All of those are more specific compared to corticosteroids, which is given in the first-line treatment. So the main question in the community is now, can we combine these inhibitors, and should they be combined with each other, or maybe also with cellular therapies that are emerging like extracorporeal photophoresis, ECP, CAR T cells, CAR regulatory T cells, normal regulatory T cells, or mesenchymal stromal cells, MSCs. Most published evidence exists for the combination of ECP and ruxolitinib. In a retrospective survey by Maas-Bauer et al., 23 patients received Rux ECP as salvage therapy for stat-refractory chronic GvHD. The best response, including CR and PR, at any time point during the treatment was 74%, so 17 out of 23 patients, including 9% complete remission rate. The 2-year overall survival was 75%, indicating that this intervention is not drastically increasing safety problems. And the newly diagnosed cytopenia occurred in 22% of the patients, and CMV reactivation without CMV disease was observed in 26% of the patients. No patient developed real CMV disease. This was more a copy number of CMV that increased. We also measured in the study the serum levels of soluble IL-2 receptor as a marker for inflammation, and it correlated well with response in the patients that received Rux and ECP. This is, of course, only a retrospective analysis, but it shows clearly that this combination is safe and has activity in a fraction of patients with stat-refractory chronic GvHD, and this concept is now tested in a prospective phase 2 trial combining Ruxo and ECP as second-line therapy. There's also data supporting the combination of ruxolitinib and axatilimab. A randomized trial combining Ruxo plus axatilimab in first line showed no new signals of toxicity, and the detailed study will be presented at the EHA meeting in Stockholm. In this trial, Ruxo plus axatilimab was randomized against Ruxo alone or corticosteroids alone as first-line treatment of chronic GvHD that is moderate or severe. Another study reported by Pons et al. Showed that the combination of belumosudil and ruxolitinib had a 6 and 12 months overall response rate of 64 and 57% respectively. This was a real-world experience or report on the belumosudil-ruxolitinib combination, patients with stat-refractory chronic GvHD, and it was reported in bone marrow transplantation last year. Another single-center retrospective analysis of 20 patients that were treatment refractory in their chronic GvHD and received a combination of ruxolitinib and belumosudil showed an overall response rate in the same range of 55%. Should not forget that these were highly pretreated patients And the study was reported by Caputo et al. In Leukemia and Lymphoma last year. MSCs have so far shown activity in acute and chronic GvHD as single therapies, but so far there's no information on the combination with ruxolitinib, axatilimab, or belumosudil. Case reports on CAR T cells for chronic GvHD showed impressive responses, and a combination with ruxo or belumosudil or axatilimab is a promising strategy. And future studies have to clarify which combination approaches will reshape future sequencing strategies in chronic graft-versus-host disease. Thank you for your attention.